Hello friends, I am Dr. Deepak Garg. I am an orthopedic surgeon and today we will discuss popliteal fossa anatomy. So it is a diamond shaped region posterior to the knee joint and it is approximately 2.5 centimeter wide. So if we look at the boundaries of the popliteal fossa, and if we have this is the medial side and this is the lateral side, this is proximal. So the proximal and the medial side, there are semi-tendinosus and semi-membranosus muscles, and lateral and the proximal side there is a biceps muscle. And on the distal side, distally, if we look on the medial side, distally there is medial head of the gastroc, and on the lateral side, distally there is a lateral head of the gastroc and plantaris muscle. So this is a plantaris muscle. So these are the boundaries of the popliteal fossa. And if we look at the floor of the popliteal fossa, we come from proximal to distal. So the proximally it is made by the popliteal surface of the femur, and then it will be the oblique popliteal ligament. So this is the oblique popliteal ligament. We can see that it is overlying the posterior surface of the capsule of the knee joint. Then we can see this is the popliteus muscle. So the distally the floor is made by the proximal tibia covered by popliteus muscle and its fascia. So after that, if we look at the roof of the popliteal fossa, the roof is made by the deep fascia or the popliteal fascia, and it is pierced by the short saphenous vein and medial and lateral sural cutaneous nerves. So these are act as a landmark in direct posterior approach to the knee joint. Then these are the main contents of the popliteal fossa. These are the popliteal vessels we can see, and this small nerve lying just medial to the popliteal vessel is a posterior branch of the obturator nerve, and we can see this is a sciatic nerve which is dividing into two branches, the common peroneal nerve and the tibial nerve. And these are the main contents of the popliteal fossa. So the fossa contains the popliteal vessels, the tibial and the common fibular nerve, short saphenous vein, medial and lateral sural cutaneous nerves, posterior femoral cutaneous nerves, articular branch of the obturator nerve, and the popliteal lymph nodes, which are usually 6 to 7 in number. If we look at the relations of the contents, so we can see, we have seen this is the sciatic nerve, and this nerve is lying centrally, direct in the center, and if this is a lateral side, this is a medial side, we can see the vessels are coming from the medial side. So the nerve is lying lateral to the vessels on the proximal side, then it is coming direct posterior to the vessels, and then it is crossing the vessels and coming on the medial side here. So the nerve is lying directly in the center, it is crossing the vessels from proximally from lateral to medial distally. So this is the relation of the nerve with the vessels. Now if we look at the relation of the vessels with each other, we can see this is the proximal part and this is the adductor hiatus. The vessels are coming from the adductor hiatus, and we can see if this is the medial side, this is the lateral side. So the vein is lying medial to the artery on the proximal side, then the vein is coming directly posterior to the artery, and then it is becoming lateral. So the vein is first on the medial side, then it crossing the artery, and then it is coming on the lateral side, and then it stays lateral to the vein artery throughout. So this was about the popliteal fossa anatomy. Thank you guys, thank you very much.